Infectious diseases then. Here's one that's, of course, familiar to us in this part of the world. And this was a study actually looking at the documented outbreaks of cholera in the Madras Presidency during 1901 to 1940, study of 26 districts. And what I've done actually is to take their graphs and just summarize them in this fashion, because it's making the point that, again, if we can think in terms of what's going on within the system at large, what happens to whole communities when rainfall comes and goes, flooding occurs, levels of surface water rise and fall. How does that affect, on the left, the concentration of cholera bacteria in drinking water? And when the water is very shallow and limited, of course, the infectivity of the water is much higher, so the risks of primary transmission on the left are very high. With the onset of rains and dilution, that risk declines, but as rains settle in and flooding ensues and you have monsoons and so on, you can see that the risks begin to rise on the right for other reasons, because of the crowding, the displacement of people, the contamination of drinking water from overloaded and flooding sewer systems and so on. So again, it's thinking ecologically about how these processes would occur. Another quite interesting example, and I should say it's one for which the interpretation is not yet quite certain, but a lot of very good work's been done, and some of it recently published in the journal Nature from workers in New York, trying to understand this new viral disease, the Nipah virus, which emerged in Malaysia in the late 1990s. It's a virus that normally coexists quietly with the fruit bats out there in the forest, feeding on the seasonal fruit. Then along comes the human species and clears some of the forest for airports, housing developments or whatever, but in this case, pig farms. Intensification of pig farming in cleared forest land with fruit orchards around the pig farms. These are huge, commercially intensive production systems. Then in 1997-98 there was a very severe El Nino event that led to a lot of drying in the forests of Southeast Asia. You may remember serious fires and a lot of haze over that area for months, contributing to a drying and a haziness that reduced the fruit yields in those forests. Forest fire smoke. So we had this apparent combination of deforestation, drier and warmer conditions, smoke haze, decline in fruit. So what do you do if you're a fruit bat? Well, you can't resist the fruit orchards. Off you go to the fruit orchards. And of course, consequently, there was virus-contaminated fruit and bat droppings on the ground. And pigs are not that choosy about what they eat. And a number of them got infected. Many of them died. And of course, a number of their human handlers were infected, and about 45% of those infected died. So it was a new zoonotic viral disease entering a human population for the first time. And in that complex story, you can see that there appears to be something to do with climate variability and climate change, particularly if, as some climate scientists are predicting, we're going to see more intense and prolonged El Nino periods in future as the world gets warmer. Another viral disease, one that's of concern to us in Australia, is Ross River virus, spread by mosquitoes. But this one has natural non-human hosts, particularly kangaroos, and quietly circulates out there in the non-human sector all of the time. From time to time spills over into human populations. And we've begun to do some studies to try and understand how variations in rainfall and mosquito population density relate to outbreaks of Ross River virus disease in Queensland and the north and east of Australia. And you can see a very clear relationship there to mosquito density, and that in turn relates, of course, to immediately preceding rainfall. But we're doing additional studies. I have a PhD student who's trying to add another variable into this equation and collect data from ecologists on fluctuations in kangaroo populations and on the viral infectious rates in kangaroo populations. so that we can piece together a more complete understanding that would help us develop models for getting better advanced warning of when Ross River virus was likely to break out. Some of the other diseases you'll have heard on in relation to climate, more obviously because they're big and worldwide issues. Dengue, for example, is the principal mosquito vector. Temperature can affect the transmissibility of this disease by speeding up the incubation of the virus in the mosquito, or its replication, I should say. Shorter mosquito breeding cycle, more frequent mosquito feeding in hot conditions, and actually more efficient transmission of the infection. Here in 2007 is the distribution of areas of risk of dengue transmission as published by WHO. Includes India and notice Queensland there in the northeast of Australia. Here's some modelling that some New Zealand colleagues of ours did a few years ago on schistosomiasis. There's a Zhou's group in Shanghai, well known for working on schistosomiasis. They previously did some work showing that in the last few decades, the northern limit of the geographic distribution of the water snail has been drifting northwards as the critical freezing temperature in January, winter, freezing zone has been moving north with underlying warming in eastern China. They've demonstrated a northward drift of the water snail population and some increase in the extension and the reported rate of schistosomiasis. Now, it doesn't prove that climate change is the cause, but it's part of a picture that's starting to emerge from studies around the world that suggest that climate change is beginning to affect patterns of malaria in Africa, schistosomiasis in China, tick-borne encephalitis in Scandinavia, a Vibrio food poisoning in oyster beds off northern Alaska as the oceans have gone warmer. There's a pattern emerging for schistosomiasis. These work have also done some modelling to predict how that geographic zone would spread in the future as China experiences warming. Okay, well, I want to come to the end, towards the end by saying, well, those are a number of the major tasks we have as researchers. We've got to understand climate health relationships. We've got to look for evidence of existing effects from now on. We've got to be able to make estimations for our government and policymakers as to the likely burdens of disease that are attributable now and in future by modelling. But we have these great tasks as societies, firstly of mitigation, reducing greenhouse gas emissions. That's the first order of business here, and we'll be more likely to do it if we have a full account of what the risks are. That includes health risks. That also provides both a challenge and an opportunity for us as researchers to ask questions about, well, how would a change of energy choice or transport affect health? And a lot of this will be good news. I mean, this could be a big opportunity for health promotion. If we were to transform our cities so that more of us were riding bicycles or walking or using public transport, good for physical activity. If we were transforming our food system so there was less remote, high volume, intensive, energy-intensive production and a greater reliance on, if you like, simpler, more local types of food production, that also could be good by dint of improving the content of the diet. Many ways you can think of. We have this task I've mentioned of reducing the risks to vulnerable sectors of our population. What we refer to in the realm of climate science as adaptation. And I quite like this counterpoint of saying that mitigation is about avoiding the unmanageable. We can see what's referred to as dangerous interference with the climate system ahead, and alarmingly not as far ahead as we thought just a decade ago. So we want to avoid what could be an unmanageable disruption of our climate system and world environment. But in the meantime, we need to manage unavoidable risks that exist now and are going to exist in the nearer future, particularly by planned adaptation strategies we can develop and evaluate. Another part of our research task. Well, here we are in Australia. Here's an example of health promotion linking the individual with the planet. think global, act local. The commercial sector's seeing the opportunity, even if the health promotion community hasn't seen it yet.